If you're watching this, you may be scared, heartbroken, feeling alone, or just trying to understand what is happening to your body. Today we're going to be discussing miscarriage, what it can look like naturally, and every option for managing it. My name is Jamie, also known as your midwife bestie. I've been attending births for over a decade. A miscarriage is a loss of pregnancy before 20 weeks gestation, most commonly occurring before 12 weeks. It is not usually caused by something a parent did. It's often related to chromosomal abnormalities in the baby. Miscarriages often start with light bleeding that increases and becomes heavier, often accompanied by clots and tissue. Not all miscarriages start this way. Some may be diagnosed on ultrasound when a fetal heartbeat is not seen or a baby is not measuring where they should be in relation to gestational age. Loss of pregnancy symptoms alone is not an indication of miscarriage, as this is a common thing that happens as moms get closer to their second trimester and is a completely normal symptom or lack of symptom in pregnancy. For women with a confirmed miscarriage, there are 3 ways that it can be managed. The first is naturally, and that's letting the body do its thing. This may not be the best option for everybody, but for women who don't have any signs of infection and bleeding is managed, this may be an option. Waiting for a miscarriage to pass naturally may take anywhere from a couple days to a couple weeks. What it can look like is light bleeding that increases over time and often can become heavier than a period. Also, depending on how far along the fetus is, it may include severe cramping that is similar to contractions. This option works for some, while may not be the best for others. The second option for managing a miscarriage is using medicine to encourage the body to pass everything. This is typically done with the use of misoprostol, which starts working within a couple hours to a day. So this is an option parents may choose if they're wanting to move the process along quicker. Heavier bleeding may last a few hours, and then lighter bleeding may last up to 2 weeks afterwards. The third option is a surgical procedure. This option may be used for moms who are showing signs of fever or infection, or for moms who are experiencing heavy bleeding, or for moms whose bodies don't seem to be passing things naturally on its own. It's typically a quick procedure, and bleeding often lasts less than a week. So we're going to go over timelines. In a natural miscarriage, it may take days or even weeks to start. Using the pill, it can be usually within hours or even a day, and with a surgical procedure, it's immediately. While experiencing a miscarriage, women often experience a roller coaster of emotions, especially related to the hormonal fluctuation. Relief and grief can coexist, and there's no right or wrong way to grieve a miscarriage. No matter what choice you make, it's important to seek emergency care if you're experiencing heavy bleeding, lightheaded or dizziness, passing out, or if you're experiencing severe pain that is not helped by medication, or noticing a foul-smelling discharge. Some providers may want to do follow-up routine blood draws and ultrasounds to make sure that everything has resolved and that mom is healthy and not at risk for infection. Once the miscarriage has passed, women often notice their cycle returning within 4 to 8 weeks. Ovulation happens before the next cycle, so it is possible to get pregnant quickly after a miscarriage happens. Your body didn't fail you. Biology is sometimes brutal. There's no right or wrong way to go through this. You deserve support, information, and choices. If you found this video helpful, hit like and subscribe for more.